The nurse is caring for a 7-year-old child who has undergone a cardiac catheterization 2 hours ago. So they're giving us information about the child, 7-year-old. The procedure was a cardiac cath 2 hours ago, so pretty recent. And when the nurse goes to see the patient, when the nurse checks on the patient, she finds the dressing and the bed saturated with blood. So we have a bleeding problem. Saturation or saturated with blood means bleeding. What is the first action to take? Once again, we have assessment, we have implementation, we have implementation in letter C, and implementation, calling the doctor. See, many students, they take the approach of calling the doctor. It's the easiest thing to do. However, learn this. If you have a scenario that you have an option to call the doctor, ask this first. Is there something that I can do? Is there something within my scope of practice that as a nurse I can do to help the patient? If your answer is yes, there is something that you can do to help the patient, do it before calling the doctor. In other words, in this scenario, if I do A, B, or C, does those answers help the patient? Yes or no? And yes, there is an answer that helps the patient. So therefore, calling the doctor is not my first intervention. So I have A, B, and C. I have an assessment answer that says assess vital signs, and I have 2 implementation answers. And let's think about the process of critical thinking. I told you, if it's an emergency, do not assess, you need to implement. This is an emergency. The patient is bleeding. There is saturated blood on the dressing and on the bed. We have to do something to assist the patient with bleeding. Therefore, I will eliminate assessment of vital signs. Now I have B and C. Which answer, B or C, is going to help stop the bleeding? Letter C will help stop the bleeding. Apply pressure to the catheter site will help stop the bleeding. Therefore, answer C is my first action over A, B, and D.